Dr. Mavis, if you are speaking, we cannot hear you.
Ah, okay. Please, can you hear me now?
Yes, please, we can.
And can you see my screen too?
Yes, please.
Okay. I said I'm happy today. I could share my screen. All
Yeah,
right.
yeah.
So thank you, Adiza, for inviting me to present on this important topic. So like she said, I'm Dr. Mavis Kwabla, and I'm a senior lecturer at the University of Health and Allied Sciences. I'm with the Fred Newton Binker School of Public Health, and I'm in the Department of Epidemiology and Biostatistics. So the topic I've been given to handle for this first session is on understanding the concept and foundation of patient safety culture. The concept and the foundation of patient safety culture. You might be on this call and probably you are like, well, I'm not taking care of patients. I'm not into nursing care. So what do I care about patient safety culture? Patient safety culture is a public health issue. It is important that people who come into our system to receive care do not go back worse than they came. And it's part of what we do in public health. So we will go through all this important topic, and I encourage you to give it all the attention it needs. There's a lot to learn. So the presentation outline will look at the concept of patient safety and patient safety culture. What goes into when we say patient safety and patient safety culture? What does that mean? We'll also explain the foundations when it comes to patient safety culture. Then highlight some key components and principles of patient safety culture. Outline some strategies to strengthen safety culture in our institutions. And then what role we as health worker or healthcare professionals can play in making sure that we adhere to those safety rules. So let's start with the concept of patient safety culture. When we say patient safety culture, it refers to the values, the beliefs, the attitude, and behaviors that ensure healthcare providers understand and are committed to patient safety within an organization. So we are talking about this not as individuals. So the values as an organization in a whole health directorate or in a hospital management. What are our values when it comes to ensuring safety of patients that come to us? What are our beliefs? What are our attitude and behaviors? So this is something that has to be instituted by the organization for all the staff members, to go by. Patient safety culture has to be an intentional process with what we call SOPs or standard procedures, standard operating procedures that guides every member of the organization. It also promotes reporting and learning from errors. So if we have that culture in an organization, it promotes reporting and learning from the mistakes that we commit. And also bear in mind that patient safety is a human right. The patient has the right to access our services and not to go back with another condition. You've taken care of what they came with, and by the time they are going, they have another thing. So it's a human right. And these days, if you listen to the news a lot, you realize that it's an issue now where patients that are going to health facilities to access service, when they are mishandled in a way, you realize they are taking the health professionals to court. And that is why this topic is very important, so that we know how to operate and stick to this kind of guidelines when it comes to patient safety culture. So patient safety culture focuses on teamwork, on communication and trust. Like I mentioned, I'm talking about values of a whole organization. So it has to be focused on teamwork. There has to be communication and trust. It has to be a blame-free, learning-oriented environment. So not to shift blame that it was this person that committed that mistake. We have to, the doctors are better at doing some of these things. They do not shift blames. When something happens, they are able to stand behind the person. Of course, that is why everyone working in the organization need to follow the rules. And if you follow the rules and something happen, you are kind of covered. So when we are talking about a culture of that ensures the safety of patients, it has to be a blame-free and a learning-oriented environment. And bear in mind that unsafe care can result in harm to the patient. So that's why we don't do things anyhow. It can also lead to even disability or death. Some people, just by mistake of administering the wrong medication, can disable somebody, or even to the point of death. So unsafe care can result in harm, and we are not there to harm people or to harm the patients, but rather to save lives. So that's why these things are very important. Okay, so when we say patient safety, so what is patient safety? It includes all the measures we put in place to prevent errors and any adverse events that may occur, any undesirable uh, um, events or situation that may arise. All the measures we put in place so that we can prevent as much errors as we can. Patient safety focuses on system-based approaches. Very important. It's a whole system. It's a whole system, and it's not dealing with just individuals. It focuses on the whole system, the whole organization system. And it ensures that safe processes and procedures. It ensures safe environments, the environment in which the services are provided has to be safe. And the outcomes, it ensures that the outcomes of the patient, when somebody has come to access service and they go back in a better form, better outcome, they go back cured, we say that this is a positive outcomes. So patient safety ensures safe processes, procedures, safe environments, and outcomes of the patient. Let's look at the foundations of patient safety. We've been talking about a whole system, a whole organization, the whole system, putting things in place. So these are very key when it comes to patient safety culture. The first one is leadership commitment. So there has to be a strong leadership support and involvement in promoting safety initiatives. So there has to be leadership trying to put together how things operate in this facility or in this organization. This is the protocols. This is how we should go about it. So leadership commitment is very important. And if that is overlooked, you'll be recording those incidences of people or workers making mistakes, coming from different angles. We'll talk about a few of those examples that could happen. So leadership commitment is very important. Another important thing is open communication, encouraging staff to report errors and concerns without fear of retribution. So when it comes to staff reporting, the staff normally will have to report to a superior, and we know, that kind of interaction when you want to talk to your boss and you know that, the treatment might not be something pleasant. It's really difficult to do that. So it has to be the whole organization system putting together things to make it easier for the staff to openly report of some of these errors committed, so that it doesn't even go into the mainstream media. Another foundation of patient culture is teamwork, collaborative work environment where staff can effectively communicate and work together towards patient safety. So it has to be a teamwork, ensuring that the whole environment, it's everyone is working together, and you are doing that because you want to ensure safety of the patient. There has to be a continuous learning. So it means every now and then there has to be training for the staff. So emphasizing ongoing education and training, including refresher courses or TOT, that is training of or trainer of trainers. So you are trained and you also transfer the knowledge to others. So it has to be a continuous learning. We don't say that, well, you are just coming from school and we assume that you've been taught everything. There has to be a refresher training from time to time for people to stick to some of these values. So a bit more about the leadership commitment that I mentioned as a foundation of patient safety culture. So let's dive a bit into leadership and governance in patient safety culture. So here, set the boundaries and the expectations for safety. What is expected of every staff member? People should not do things on assumption basis. Set the boundaries and the expectations for safety. Make the resources available for safety initiatives. Sometimes people do things and errors result just because the resources are not available and they are trying to improvise. So as part of leadership commitment in patient safety culture, the leadership have to make the resources available for safety initiatives. They should also encourage speaking up and open communication, very important. This is something that has to be established by the leadership. Then create an environment that supports reporting and feedback system. So do people know where to report in case of any of such incidences? So that environment has to be created by the leadership of the organization. Communication, I mentioned communication as very important. So communication has to be clear and timely. And we can employ those standardized communication tools. Something we call the SBAR is a tool for healthcare reporting, especially when you are reporting from a junior member to a senior staff. Okay, so we go through what this SBAR stands for. So the first one is S. The first S is situation. And here you need to identify yourself. So this is a tool for reporting. Whether you want to report an error, something that happened, you use this tool. So the S is situation. That is, you identify yourself and your unit. Which unit are you operating? Are you in which of the wards or which units? State the immediate issue or the concern that you want to report about. Describe the patient situation briefly. Sometimes before somebody is reporting this thing, some error has occurred. Either the wrong medication has been administered. So describe the patient situation. If it is something that needed urgent situation, or if it is something that it's not it's not serious. So you describe the situation. Then the B is background. That is the relevant clinical background or the context. So here you talk about the diagnosis of the problem. The diagnosis of the problem is if it is medication that has been administered, what kind of medication has been administered? Make sure they were. Okay. What is the clinical history? How did the patient come in and how is the patient looking now? What is the current vital signs? Okay, when you check the person's vital signs, like the temperature, the person's blood pressure, what is it? So those kind of current vital signs. Then assessment. A is assessment. What do you think the problem is? So your professional assessment, when you assess the person, what you believe is happening based on the data that you have. How severe is this problem? You've done an assessment, professional assessment of what has happened. How serious is it? How severe is the problem? Then, of course, recommendation. And this is normally like a form that has all these areas, making it easier for the staff member to easily get this to the superior or the bosses. Then you make recommendation, what you need or what you want to recommend to solve the problem. You want to say that next time around, let's make sure something like this is available. If you are handing over to the next person, there has to be a communication so that you know where somebody is stopping and where somebody is coming in. Maybe the one who is leaving has given this medication already. Another person came and also gave, so you make a recommendation, specific actions needed. How urgently is it needed? Very important to state that, because in a bigger organization, you may have several of these reports coming in, and we have something we call triage, where you look at which of them should be given priority, and so these are very important things. Also, apart from the foundations, communication is what had brought us here. There are also points of sharing lessons from incidents. So anytime there is an incident, there's an error or something that happened, it is important to share the lessons so that people can learn from it, and not to repeat those kind of errors again. Then encourage questions and clarifications. If something is not clear, your boss has communicated something to you and it is not clear, it is important to ask questions. Say, can this be clarified a bit? So this is something that has to be encouraged in the organization. And once it is encouraged, we know that The staff can be free to ask questions when they don't understand or ask for clarifications when something is unclear. Teamwork and collaboration in patient safety culture. So this is the same teamwork we talked about, just that we want to throw more light that teamwork is very important and it's one of the foundations when you are talking about patient safety culture. So here there should be shared responsibility for patient safety. Patient safety should be the responsibility of everyone in the organization. Whether you are an administrator in the hospital, you are a public health person, you are a laboratory person, it should be the responsibility of all of us to make sure that we put the safety of the patients first. Then there should be respect and trust among the team members. There's a need for coordination between professionals. So even it can be professionals in other places, we need to have a way of trying to coordinate the activities between professionals. And then the needs for joint problem solving and decision making. Learning systems and incident reporting. So when something happened, how do we report the incidents? So here we encourage reporting of what we call near misses. The thing nearly happened, but it didn't happen. That also has to be reported. You nearly made a mistake, which would have ended in something else, but it didn't happen. Those things still have to be, we have to encourage staff members in the organization to report all those near misses and errors. So a near miss is an event that could have caused harm to a patient but did not, either by chance or because it was caught in time. So for example, a nurse almost administers the wrong medication but notices the mistake before giving it, and probably administering that wrong medication. Of course, we know if you administer a wrong medication, it may lead to harm, So the nurse almost did it, but didn't realize it maybe at the last minute and it didn't happen. All these have to be reported. And if we don't have, those procedures, those protocols in the organization, these things may go unnoticed, and somebody will do it and the next time it will happen before they realize they've done the wrong thing. So the near misses also have to be reported. Focus on understanding and not blaming. I mentioned that the medical doctors are really good at doing this. They know how to make sure that they cover each person up. Of course, not covering them when they've done wrong, but critically make sure that the person, if the person did what he did because of probably given the circumstances, you don't leave the person alone. So we do not blame when we are talking about patient safety. Use of data to guide improvement. So the reporting of errors that we are gathering over time, we should be able to review these things and use it to put in all those kind of things we need to put in so that subsequently we don't have those kind of incidences happening. And then the feedback loop, has to be corrected so that we can improve practice. Now let's look at some strategies needed in enhancing patient safety culture, identifying and reporting errors. So here, establish a culture of safety where staff can report errors without fear of victimization. If I know that I report and that will put me into, serious trouble, then I wouldn't dare reporting. So we have to establish a culture, where staff can report errors without fear of victimizations. Then there has to be training and education. There has to be ongoing training on safety practices and protocols. Every now and then, we have changes in the protocols that we are using. And it is important to always give refresher training to the staff so that they know the current things that are in place. Then establish clear policies, define and implement clear safety policies and protocols, easy to use in reporting errors. Sometimes people feel reluctant to report just because of how complicated the forms are looking. If we can make it, we can have policies that are very clear, people will be able to report when the need arises. And then creating a reporting culture. Encourage staff to report both near misses, that is nearly happened but didn't, or actual. So report both the near misses and what actually happened. And then analyze the reported errors using root cause analysis. Root cause analysis is one of the topics we'll be looking at in details. And that will be later on. Okay. Implement safety training programs, very important. Promote open, blame-free reporting. Adopt standard operating procedures. Encourage leadership workarounds, very important. Then conduct safety audits and feedback. These are the strategies we use in enhancing patient safety culture within an organization. Now let's look at some of the measures, patient safety measures in public health. So in public health, we have these strategies. These strategies are public health measures used to prevent the spread of disease by limiting contact between those who are sick or exposed and those who are not. At the time of COVID, there were two words that were commonly used, and that is isolation and quarantine. And at that time, people were really using these words interchangeably. Sometimes what they are referring to is actually quarantine, but they will be saying isolation. And sometimes they will be saying something that has to do with isolation, but they will be using the word quarantine. So isolation, when you are dealing with isolation, this is done in hospital setting or other health facilities. This is where you separate the sick individual, somebody that has an infectious disease. It has to be an infectious disease, because if it's a disease that cannot spread to other people, then you do not have to isolate the person. Somebody has hypertension, high blood pressure. It is not something that it's a non-communicable disease. So you do not isolate people in those cases. But in the case of an infectious disease, that is capable of being communicated or spread to other people, then they have to be separated. And so even in the hospitals, they have what we call isolation wards, so that those who have those kind of diseases that can spread, you don't mix them together in the same ward with the other patients. Otherwise, other patients might, by the time they are okay and going back, they might be contracting other diseases. So these are very important public health terms, isolation. And then when you are dealing with quarantine, this can be done either at home or in a designated location. And here you are looking at separation of people that are presumed or suspected to be cases. And so in the case of quarantine, the people do not have the condition, but they have been in association with or in contact with somebody that has a disease. At the time of COVID, if you remember, because everything started from China. So if you are coming from China, you are, first of all, we need to quarantine you. Because for all you know, you have been exposed to the infectious agents and your body system is incubating it. And if the incubation period is within 14 days, then we'll have to quarantine you for 14 days. by which time, if really you have been exposed, you will come down with a disease, and then you can be given the necessary treatment. So these are very important public health measures, which you want to do to prevent spread of disease within the populations. Issues of burial restrictions is also part of patient safety measures in public health. There are diseases that people die with that you cannot release the bodies to the families. Even if you want to release the bodies to the families, right from the mortuary, the body has to be put in the coffin so that the family doesn't have that kind of contact, which may end up, leading to spread of diseases. In public health, the immunization services that we give, whilst we are giving injection, there are safety policies, injection safety policies. So here, this is from there's a policy document on immunization in Ghana, and these highlights are from there. That's one injection, one injection per person. Sometimes there are people who use a syringe for another person, and because they travel to a long distance, into a community to give immunization, and probably they mistakenly left some of the items they needed, and before you realize, they are attempting to use one syringe for a number of people. And that is why these days the syringes and the needles available are called auto-disable syringe. And for them, once you have used it, it's locked. You cannot even pull it to withdraw or fill in with any vaccine to give. And all this is because of patient safety. No recapping. You yourself will end up injuring yourself, when you attempt to recap after giving the injections. All the used syringes must be immediately put into a safety box. The safety box are done such that when you are burning them, it's able to burn, with the needles. It's not just any box that we put the syringes and the needles with. The other normal boxes, you might see the syringes piercing, and coming out. So all used syringes must be immediately put into a safety box. Safety boxes should not be filled beyond 3/4 of its volume. All safety boxes must be incinerated. Mostly is at the hospital level, because at the hospitals they give a lot of injection, so they have the incinerator. The incinerator is what can burn. In situations where you don't have incinerator, a pit can be dark and then you burn it. But that most of the time you will have residues of the metals. Even some of the incinerators too, depending on the temperature, some of them may also not burn everything. You still have residue, which you will have to bury. So no harm to vaccine provider or to vaccinee. Very important. There should be no harm to the vaccinee, even to you, the provider yourself, and to the community. Let's talk about a few benefits of a strong patient safety culture in an organization. So if you have an organization that has a strong patient safety culture, what are the benefits? The first one is there is reduced medical errors. So there will be an improved safety practices in this organization, and in turn, it will reduce the likelihood of errors and adverse events. It will also lead to an improved patient outcomes. So better safety measures leads to better patient outcomes and satisfaction. So people will leave the facility satisfied. Then staff engagement. Staff engagements, encouraging a culture of safety increases staff engagement and job satisfaction. So the staff have to be engaged every now and then. And once that is done, they all know what to do, and it will lead to job satisfaction. Now, there are some tools, some tools that can be used to assess for patient safety culture. And mostly we use the surveys. And these surveys, surveys that is using standardized tools like the hospital survey on patient safety culture to assess the perceptions and attitude towards safety. Recently I'm in the UHAS Hohwe campus, and the Hohwe campus is actually within the Volta Regional Hospital. Beginning of this year, the hospital management asked us to conduct a patient satisfaction survey. Those kind of studies should not be done by people who are within the hospital system. You cannot assess yourself. You will end up writing report that shows that all the patients are 100% satisfied with your services. So it is important, if you want to do those kind of surveys, to look at the level of satisfaction of the people that we render service to. This should be done by external people, like the Volta Regional Hospital did by contacting those of us in academia to do the research for them, which we have done, and we have the reports ready for them. So those are assessment tools. You want to see if people are adhering to the patient safety culture. Then there can also be observations and incident reporting, so monitoring incidents and near misses to identify areas that needed to be improved. Of course, there are also challenges when you are attempting to promote patient safety culture in an organization. You will be faced with some challenges. So let's look at a few of them. The first one is resistance to change. Resistance to change. Overcoming resistance to new safety initiative or protocols. Organization will always resist change. People are used to the normal way they do things. So anytime you want to bring about a change or something that people are very comfortable with, you'll be faced with resistance. So resistance to change is one of the challenges when you are trying to promote a patient safety culture in an organization. And the time and resources, limited time and resources for implementing and sustaining patient safety measures. Sometimes issues of resources, makes people not able to adhere to some of these protocols. They say in our African settings, we are always good at improvising, but let's make sure that we are improvising in a way that will not lead to the harm of the patient. Then organizational hierarchies. Addressing hierarchies that may hinder open communication and reporting, or poor communication channels. So this can also be challenging. Sometimes the hierarchies of the organization makes it difficult for people to be able to openly communicate and report errors. So it's important, if we can address this, then we are able to promote patient safety culture. Sometimes people refuse to report on those kind of errors because they fear that they will be blamed or they will be punished. Some people can even lose their job in the process. And those things may be the reason that people may not want to report. The workload and staffing challenges, these are also some of the things. And then even lack of leadership support. if there's lack of leadership support. These are some of the challenges. Now, with the health workers, the health professionals, what will be our role if we are talking about patient safety culture? What will be our role? So we need to play the advocacy role, okay, and support, promote the importance of patient safety culture among health workers, healthcare providers, and organizations. So we need to make sure that we are advocating, and supporting the importance of patient safety culture. Collaboration. We need to facilitate collaboration between healthcare organizations so that we can share best practices and resources. So if something good has been done in another place, it is good to share those practices so that others can learn from it. And this is something we can encourage. Then continuous improvements. Encourage ongoing evaluation and improvement of safety measures. So we have to, from time to time, we need to evaluate the system. We always say something that if you put in an intervention, whether you have given training to the staff on how to report errors or on performance of something, after some time, we should try to evaluate those tools or that intervention we have introduced to see if it is working as planned or if there's a need to change some things and improve safety measures. So continuous improvement is very important and is part of the role of we healthcare professionals when it comes to patient safety culture. Healthcare workers should be encouraged to adhere to safety protocols. When you visit an organization, there are protocols here and there. People should be encouraged to adhere to those protocols. It's not just being pasted there, but we have to follow it. In the hospital system, they have what they call triage system. When you come, depending on their condition, you should be the one to be attended to first. Are people adhering to this kind of protocols? Wash your hands, before you attend to a patient. Are we adhering? So these are things we need to encourage health workers. They need to stick to the safety protocols. They should report incidents and near misses. They should also participate in safety meetings. That's where they will have the opportunity to learn. Improve communication with colleagues. Sometimes there are some things you are not sure of, and that is why the mistake happens. So if you are not sure of, why don't you talk to a colleague? Why don't you talk to a colleague and share the ideas? We say knowledge is not in one person's head. So it is important to always communicate with your colleagues, get ideas, that can help you prevent that kind of mistake. There's no shyness in that if you don't know something. Sometimes it's just pride that will make somebody not want to openly say, oh, can you help me with this kind of procedure? When I was working in the Ghana Health Service, my district director mentioned to me, a medical doctor, she said there was a simple surgery that he learned it from a hospital or orderly person. That's the person he learned that from. So this is just to say that if you don't know, you learn it. So we need to improve communication with colleagues, sharing ideas, as healthcare professionals. Advocate for patient-centered care. The patient should be our focus. When we come to the facilities, the patient should be our focus. It's only these days that, if somebody shows that in the health system and workers are just looking as if they are not there for the patient. So these are things we have to advocate for, that let the care of the patients be the central point. We need to know, like in a normal business settings, that They will tell Ghana Health Service will say your health is our concern. If the person's health is your concern, then we need to make sure that we put in all the necessary measures so that in delivering our services, we don't end up causing harm. So in conclusion, patient safety culture is essential for quality care. If we can put in all the measures for patient safety, then it will result in quality care for all the patients that come to us. It requires a collective responsibility. I mentioned from the beginning that it is something that has to be established by the organization, by the leadership of the organization. Everyone has to be involved. Everyone, even to the cleaner of the facility, or to the gardener, the one that weeds. Everyone have to be involved, because somebody can leave something somewhere and the patients, run over it, and that will cause harm to them. So it's a collective responsibility. Patient safety culture is a collective responsibility. Sustainable improvement rely on leadership, on learning, continuous learning, and on teamwork. So basically, this is all I want to share with you on concepts and foundations of patient safety culture. I'll be on the standby for question. Thank you for your attention.
Thank you so much, Dr.
Thank
Mavis.
you.
That's very, very wonderful session. I'm sure my colleagues have also understood a lot. Please, we have some time for questions. If you have questions, you're able to unmute yourself and speak. The reason why we muted everyone, we usually, from our past events, you find out people muting themselves, unmuting themselves and disturbing the session. So this time around, we muted everyone, but right now you are able to mute yourself. Sorry, you are able to unmute yourself and speak if you have any question. Okay, I think we don't have any question for you today, Dr. Mavis, but if any question comes up, we'll do well to share it with you. Thank you so much for such a wonderful session. The session is being recorded and it will be posted on our website when it's ready. Thank you all for joining. So tomorrow wouldn't be having the session. We don't have sessions on weekends. So the next session comes on Monday. So thank you all for joining the session. Bye-bye, everyone.
Thank you too.
Bye. Thank you.
Right. Thank you very much.
Thank you.